Good morning everyone. Thank you for coming to this talk on stroke recognition. We are lucky to have Denise Watts with us from the Stroke Association today. Welcome Denise.
Good morning and thank you for asking me to talk to you today.
You're very welcome. Can you start by explaining what a stroke is?
Sure. You may hear it called the cerebrovascular accident or CVA. It is also called the cerebrovascular event or CVE. Basically, a stroke is a type of brain attack. There are two main types of strokes. The most common type is called ischemic stroke. This causes the blood supply to the brain to be disrupted. The second type is called hemorrhagic stroke. During this type of stroke, a weakened blood vessel ruptures and bleeds into the brain.
I see. So stroke happens when the blood supply to the brain is blocked.
Right. The blood flow is usually blocked by a blood clot in one of the main arteries to the brain. This means that valuable oxygen is also stopped from getting to brain tissues. This is what causes the symptoms of stroke.
What are the symptoms of stroke, Denise?
This is where the acronym F.A.S.T. comes in. It's very important for people to be able to recognize the early signs of stroke so that treatment can be started as soon as possible. To help people recognize the symptoms of stroke quickly, the F.A.S.T. acronym has been developed. It stands for face, arm, speech, time.
Okay, what does this mean for people who think they may be having a stroke or looking at someone who they think is having a stroke?
It is actually an assessment of 3 specific symptoms of stroke. F stands for facial weakness. You may notice that it is difficult for the person to smile. Perhaps you notice their mouth drooping on one side. Their eye may also droop on one side.
Yes. I think we've all noticed those signs on a patient who's had a stroke. What about the letter A? What does that stand for?
The letter A stands for arm weakness. Ask if the person can raise both arms. Notice if they are unable to raise one of their arms.
I see. Presumably it would be the same side as the facial weakness. And the letter S, what does it stand for?
S stands for speech problems. Is the person speaking clearly and understanding what you are saying? If you notice that they are slurring their words as if they were drunk or perhaps not able to speak at all, this is of concern.
Of course. This brings us to the last letter, T.
This is the most important one. T stands for time to call the emergency number. The quicker emergency treatment is given, the better. Hopefully further damage to brain tissues can be avoided.
Yes. We can't stress this too much. One more question. Should we use F.A.S.T. for mini strokes?
Good question, Ingrid. Mini strokes are also called TIAs, or transient, ischemic, attacks, because they have similar symptoms to strokes, but the symptoms tend to go away within 24 hours. They are often a warning signs of a future stroke. It's important to do a F.A.S.T. assessment on a person in either a mini stroke or a stroke because you never know.
That's right. Well, thanks Denise for coming in to talk to us today. I'm sure we've learned a lot.